everybody. I am back from vacation. Don't I look so relaxed and ready and eager and excited to share this information with you? I had an awesome time. I went down to the beach, and I encourage all of you as much as you can to spend time by the ocean, by the water. It's so healing, it's so therapeutic, and I really had a chance to reset. I had a chance to think about my goals, my intentions for the next year. And this talk is actually inspired from a book that I read on vacation by Alda, the actor. And I'm going to tell you a little bit about it as we go through this lecture tonight. The topic I want to talk to you about is very broad. It's about the value of communication. But what I want to do is try to make it more focused on us as doctors and as care providers, and how is it that we're doing a good job, or how is it that we could maybe be doing an even better job. So if we think about communication, it really goes without saying that it's critical to all relationships. We are so fundamentally social, and the way that we maintain our socialness, our connection, is through communication. Now, in our culture, of course, we are very verbal, but there are many other ways to show that we have received information, many ways to show that we empathize with other people expressing their emotions. But sometimes we can really lose our way, I think, especially with the pressures that come on being a medical provider. So much of our learning is socially based. Social learning theory is very well established in psychology, and really the idea is that we learn everything by observing, by doing, and repeating this process over and over. There are parts of our brain that have evolved just to keep us social. So just two examples are, we have something called the Fusiform Gyrus, and its only job is facial perception. The more familiar someone is to us, the more it gets activated and lights up and gives us all of our feel-good hormones. We also have something called mirror neurons, and these are amazing things that are in the brains of monkeys, apes, and humans. And the idea is that they actually help us anticipate the behaviors of people that are in our immediate environment. So the idea is that when we're watching someone, we're really not just taking in their words, they're communicating to us in all sorts of ways non-verbally, with eye contact, with tiny little changes in muscle movements in the face, by, of course, using our hands. There's so many different ways that people are communicating with us, and it's really our job to become active listeners, and that is a key skill that doctors need to be taught, and that really all of us would be better for honing those abilities a little bit more. I think there's some interesting data that you might find to be relevant to this talk, which is if you look at groups of children who were either abused or neglected in childhood, the children that were neglected actually do worse in the long run. So they have more mental illness, they tend to die by suicide more, they tend to hurt other people more, they tend to have very low empathy and be antisocial. The children that were actually physically beaten and abused, emotionally abused, they actually, of course, they still suffer and they have a lot of mental health struggles, but they actually do better. So the point there is that neglect, being ignored, is actually so fundamentally anti-human that it's extremely traumatic to us. The other thing we know is that older adults who identify as being lonely, not necessarily those that spend a lot of time alone, but those that would say, I really do feel lonely, they're much more likely to die earlier, to be depressed, to have mental health issues, to have physical health issues, to have more pain from the same amount of, a level of arthritis, much more likely to go to the primary care doctor. So this lack of social connection can really get us into trouble physically and mentally. There is a psychologist named Erik Erikson who is very well known in the developmental literature. And actually, before I started off my academic career, my last job I had was working for his home care company in Cambridge, Massachusetts. So I've done a lot of reading on him because I was kind of involved with that center for a while. So he really taught us a lot about different developmental stages, but he really focuses on communication as being essential for our integrity as human beings, and that this is a basic human need to have a reciprocity back and forth of expression and someone receiving it and you then expressing and receiving. But the problem, I think, becomes what happens when there is a brain disease or a brain disorder, and things like language fails, and things like eye contact doesn't work as good, or people's facial expressions aren't as communicative? Is that hurting care and hurting people's ability to have this very basic human need met? So I think we would all agree that understanding and being understood is really the essence of communication, right? And this is essential to feeling like you are getting good care from your medical doctor. But what does this require? It really requires their ability and willingness to understand and to respond to both the explicit and the implicit messages that people are giving in their doctor's appointments. So like I said, I really have concerns when people come in and they have significant cognitive impairment, they have aphasia, trouble talking. Even folks with Parkinson's disease can have trouble expressing their emotions on their face because of some of the motor symptoms that go along with having that movement disorder. So what's very important is that we talk about this stuff, that you know that it's a valid concern, that if you don't feel like your doctor is getting you and connecting with you, you need to advocate for a different doctor if you have any position of power as a patient. We also have to advocate for doctors, medical providers, to get better training to pair their humanity with their technical skills, okay? And if you agree with me on that, you can definitely give me a thumbs up, throw me out a heart, let me know that you feel what I'm saying. So thank goodness the concept of what makes a good doctor has evolved. We definitely are not machines that are in need of repair. We are human beings who are experiencing a physical or a mental distress, some type of pain. The problem is now that we have mighty challenges as doctors to maintain the amount of face time that we get with patients. There's a tremendous pressure in most medical practices for documentation right now. You might even notice how often are you going to your doctors, and instead of seeing this face talking back to you, you're seeing the side of someone's head and maybe even the back of their head because they are on their keyboard. This drives me crazy. I once did not hire a doctor to work in my practice because they were insisting that they were going to write notes during the doctor's appointment, and I said, absolutely not. It is critical that we look people in the eye. I mean, how could we have lost that value? That's something that really bothers me. Nowadays in medical environments, we also have a lot of clinical burnout. People have to see a lot of patients to maintain satisfactory ratings from the chairs of their department and their supervisors. This is one of the reasons I chose neuropsychology over other subspecialties in medicine, because we actually are one of the only providers that gets a lot of time with patients. And I've told you guys this before. We get about an hour for our interview. Our testing is anywhere from 2 to 4 hours. Then we get about 5 to 6 hours to write our report, put it all together, and communicate it back to the patient in a 1-hour session. So to me, this feels like respectful care. It's comprehensive. It allows me to make personalized recommendations. It allows all neuropsychologists. This is what we all do. You know, I like to think that I give my own personal stamp on the way I do neuropsychology, but a big part of me being with you is I want you to all understand what this profession does. We really try to see the person first, and then the brain disorder, then the mental health issues, the physical disabilities, and figure out how it all runs through the individual. So what are the parts of good communication? Well, I think, and you know, other social scientists I think would agree that it comes down to 4 things: respect, trust, active listening, and compassionate responding. So I thought maybe we could spend a little time talking about these. The first thing as it relates to respect is, as a doctor, not walking in the room and having a big ego, feeling like you are the professor in the white coat and that you are the only expert in the room and what you say goes. It's very important to me that as a doctor, I empower my patients with the fact that they are experts in their own condition. And their spouse is an expert, their daughter is an expert. And hopefully I have a different kind of expertise, academic expertise, clinical expertise, and real care is going to happen when we validate these two sides and we bring their expertise together. So how is it that we can communicate respect? Well, some of it is just so basic and good manners, it's kind of shocking we have to talk about this, but how about just eye contact, right? Getting away from the keyboard, talking to individuals. Shaking someone's hand, making human contact with them when you first meet. Making sure that the person is physically comfortable. Do they need water? Is that chair okay? Can I help you get down? Can I help you get up? Making sure they feel psychologically comfortable, safe. It is very scary to go to see a doctor like me. I'm coming in, going to talk about my memory problem. Maybe I'm going to find out it's not just normal aging and it is dementia. Well, I have to pay respect to that person by valuing their experience before they get into my office, right? I try very hard to be aware of body language. People tell us so much by the way that they hold themselves, the way that they might not be able to look at you. So that's a level of respect too, which is not just tearing into my script as a neuropsychologist and here's what we're gonna do, but really taking the time to respect the person and meet them where they are. The next one is trust. Now, trust is the cornerstone of all relationships, of course, but I do think there's a special trust that happens between a medical doctor and a patient. And it's not something that can come quickly. It is something that is gained through repeated interaction. So one concern, and again, this is a necessity of the current medical system, but how many of you are not actually getting to see doctors as much anymore? They now spend some of the budget with physician extenders, which are nurse practitioners, physician's assistants, and many, many times these people are extraordinary and they have excellent training. But I think that there is a public image issue with people feeling like they want to see the doctor. And maybe we have to change that and empower those professions a little bit more, but I do think it's interfering then when the doctor makes a recommendation. It is not as valued as it might be coming from someone the patient perceives as not the doctor, okay? There's an interesting story about physician lawsuits that I wanted to share with you as it relates to transparency, which I think is a part of respect. And what this is the idea that this doctor is also a human being. They are not, again, the almighty wizard that comes into the room, that they themselves are fallible and that they can make mistakes. So I believe it was the University of Michigan one year decided to not follow their lawyer's advice. And when there was a medical mistake, a malpractice event, instead of instructing their doctors to button up, not talk to the patient, and the lawyer would just start sending letters that were kind of, defense, the doctors did something different. They went into the room, they looked the person in the eye, and they admitted their mistake. And they said that they were sorry, and they explained what it is that they learned from this experience and how future patient care would be impacted. And sure enough, the lawsuits went down from something like 43% to 9%. It was unbelievable, and that's such a compelling piece of data because it just tells us we want our doctors to be human. I really don't think we expect perfection, but we don't expect robots either. We really need people to bring their humanness into the room. Active listening is the next one. So what does this mean? This is coming into any conversation with such a tight agenda that you cannot be flexible to what is being said to you in the conversation. It is really attending to the responses that you get and then being able to flexibly adjust what it is your response is. So much of poor communication is based in not properly listening because we project what we think the person thinks and feels. They're projecting what they think we think and feel, and it's just like two people might as well be speaking Greek to each other. So how is it that we can accomplish more active listening? Well, asking open-ended questions is very important. Being truly interested in what it is the person has to say. And with people with brain injuries, it's so important to be slow and to allow for that back and forth reciprocity, even if the person isn't able to keep pace with the crazy demands of the way we communicate these days. So being spontaneous, taking turns, even if it's nonverbal. Sometimes I have patients and it's very hard for them to communicate with me, but there is a dance that you can kind of do with people to show them in some way that you care about how they're feeling, what they're thinking, and try to pick up on the subtleties of their expression, and then you're reflecting back, because really communication is very simple in some ways. It really is it's like throwing a ball back and forth, right? And if one person always has the ball, that's not really fair. And we have all of these brain structures I was telling you about too earlier that pay attention to reciprocity and back and forth. And it's when that is denied that people have social, spiritual pain, right? So even if we can't use words, it really is our job to figure out how to pick up on the other cues. So remember before I was telling you tonight's talk was inspired by this fantastic book that I read from Alda. So it's called If I Understood You, Would I Have This Look on My Face? My Adventures in the Art and Science of Relating and Communicating. So he has something called the Alda Center for Communicating Science at the Stony Brook University School of Journalism, and he started this in 2009. It's a cross-disciplinary program, and it's so cool because it's using theater and improvisational techniques to train scientists and doctors to do better at understanding and interpreting the needs of others, to either communicate with media, other people, through platforms like this, or with patients. And the key that he is working on is developing empathy skills. And he feels that improvisational theater exercises can really get at this, because you have to pay critical attention in order to know how to respond. So one of the recommendations that he makes in the book, I wanted to tell you guys about because it's really interesting. So he feels that one of the critical pieces of this is emotional identification. So being able to not just rely on words, that's kind of lazy. So what he does as an exercise, and he actually did this for a year, and he said he almost drove himself crazy, is he listened to TV with the volume off, and he forced himself to identify every emotion that he felt like he was picking up on from the people. And he said, in fact, he got so obsessed, he went around and did this with taxi cab drivers. Even in doctor's appointments, he would wear headphones sometimes to tune them out so he could just really try to focus and kind of strengthen this muscle of nonverbal listening. It's really interesting. So the final one is compassionate responding, which is truly being interested in the person's distress, being able to feel connected and empathy with what the person's expressing. But there is a key there, which is to not drown in it. That is one thing I can tell you from my experience as a doctor, that some days can be very hard for me and I don't always succeed. Sometimes there are things that happen in my office that are so profoundly sad and moving that I will tear up and I will cry. And there's a big part of my training that would tell me that that is not okay, that is inappropriate. And I think that the new generation of psychologists and mental health professionals doesn't quite buy that. We really value the human joining, the human emotion and connection. But the key is I can't sit here and boo-hoo myself to the point where the patient has to then comfort me, right? So we need training as doctors to be empathic, but we also can't dive too far in so that we wind up drowning and then we can't use our expertise to help people. One of the new trainings that they're doing with doctors is actually training them to use the word we when they communicate instead of I or you. So something, for example, instead of like, you will get through this very difficult time, I have a plan of treatment for you. We will be getting through this together. We will work on a treatment plan that we both agree on. We will check in with each other. And it's really amazing to me that that one little shift, that tiny little change in a pronoun can be so profound, but it really does have a big impact. So some other things we can do when people that we care about don't have access to words is, of course, eye contact is critical. Feeling and sensation become that much more important. Gentle, slow, respectful touch and handling while trying to get the consent of the person. Interpersonal warmth, thinking about how your face looks, how your body language is. If any of you have read the book Stroke of Insight, this was a neuroscientist who had a stroke and she gives her first person account. It's a really fascinating book, but one of the most poignant passages for me is when she talked about the experience of doctors coming into her room when she was in the acute recovery stage. And what she really emphasized was how loud people's voices were, that there didn't seem to be this respect for her sensory overwhelmment. And that's something that I think too we really need to be mindful of, is how are people receiving us? You know, a lot of people do that thing where they talk really loud and slow when someone has cognitive impairment because they assume it's a hearing problem. So you can pick up on if you're connecting and landing with someone. I mean, that's a big part of being a public speaker, is like, are people getting me here? Am I seeing all the agreement, or am I getting like boredom and confusion? So why is this important? Well, first of all, it's just ethics, right? Let's face it, it's the right thing to do. It is so therapeutic for the doctor and the patient to be good listeners and to join and care together. When the patient feels like they are a co-creator or co-designer of treatment, research tells us we get better outcomes in terms of compliance, we get less fear, less anxiety, less uncertainty, more self-confidence, more satisfaction, and maybe most importantly, the person's sense of control and integrity increases. So trying to tie that back with some of my earlier points, it really is a very basic human need, and I'm hoping that with the change in thinking and some of the training that is going on now in medical education, that we are recognizing more and more the importance of communicating, the very need for it, and how we can do it better. So I hope you guys thought this was interesting. I'm actually going to leave next week's topic up to you guys. I'm calling it Dealer's Choice. You guys write in below and tell me what it is you want me to talk about. I'm trying to think about different ideas and different projects for the next year. One of the things maybe you can help me think through is I really want to try to find a way to reach more people with these messages. As you know, if you've been listening to me, one of the things that really bothers me is that the biggest voice in brain health and brain science right now seems to be marketers with products and supplements and brain games, and I don't agree with that. I really want to balance the public dialogue with science-based education and empowerment, so you are informed and you can make your own decisions. So I have been thinking about maybe doing this as a podcast, because maybe that's a way to reach more people, maybe putting some time into trying to do some more media related things. But you guys are really smart out there, and you guys got all sorts of good ideas, so maybe you can chime in and let me know if you think there's any avenues that I could be pursuing. So thank you guys so much. It feels so good to be back and rested, and I appreciate you guys listening so very much. Take care and have a good night. Bye-bye.